السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Questions. This is lecture number 10 in Maternity and Child Health and number 49 in Ghaith Review. Today we are going to discuss 5 questions from question number 262 up to question number 266. معاكم محمد اسماعيل يحيى. نبدأ مباشرة. Question number 262. A post-date pregnant woman is admitted for the induction of labor. Her fetal heart rate and vital signs are within normal range. Her intravenous line is maintained and she is to be started on low dose of labor-inducing medication. Which of the following medication is the mother likely to receive intravenously? The options are number A, oxytocin, number B, cervidil, number C, cytotic, number D, cytoxan. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A, oxytocin. اللي اخترنا الخيار رقم A نشوف rational. Oxytocin is a hormone that is used to induce labor or strengthen uterine contraction or to control bleeding after childbirth. It comes in forms of injectable solution. So the correct option is option number A, oxytocin. Option number B, cervidil, is a gel or suppository that is placed directly onto the cervix through the vagina for inducing labor. And cytotic belong to class of drug called gastrointestinal agent, used as prophylaxis to prevent ulcer and as pregnancy termination. And option number D, cytoxan, is a cancer medication, chemotherapy. So the correct option is option number A, oxytocin. Question number 263. Which of the following patient is at risk for cord prolapse? The options are number A, a fetus that remains at a high station. Number B, mother with oligohydramnios. Number C, presenting part at station positive. Number D, intact membranes. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number A, a fetus that remains at a high station. اللي اخترنا الخيار رقم A نشوف rational. Umbilical cord prolapse occur when the umbilical cord drops or prolapses between the fetal presenting part and the cervix into the vagina. It occurs prior to or during the delivery of the baby. Common causes of umbilical cord prolapse include premature rupture of membrane, preterm labor, multiple gestation pregnancies, polyhydramnios or excessive amniotic fluid, malpresentation of the fetus, and the negative fetal station. So the correct option is option number A, a fetus that remain at a high station or negative fetal station. Option number B, C, and D are not causes of umbilical cord prolapse. Question number 264. While taking care of the patient with a spinal cord injury, the patient suddenly complains of pounding headache. Upon assessment, the patient was found to have diaphoresis, drop in heart rate, and elevated blood pressure. Autonomic dysreflexia is suspected and head of the bed is elevated. Which of the following is the most appropriate action immediately? The options are number A, notify the physician, number B, assess bladder for distension, number C, continue to monitor for the next hour, number D, try to calm the patient. وقف الفيديو هنا واختار الخيار اللي بتشوف صحيح. The correct option is option number B, assess bladder for distension. ليه اخترنا الخيار رقم B؟ نشوف rational. Autonomic dysreflexia is a potential medical emergency characterized by uncontrolled hypertension and bradycardia. Also, tachycardia is known to commonly occur. It occurs most often in individuals with spinal cord injuries. A full bladder or an ingrown toenail can be enough to trigger autonomic dysreflexia episodes, in addition to constipation and kidney stone and many others. So, therefore, the most appropriate action immediately is to check the bladder and bowels, since fullness or a blockage are usually the causes of the problem. So the correct option is option number B. Question number 265. Vital statistics and control of communicable disease serve many functions. Which of the following is the basic function for health? The options are number A, public, number B, mental, number C, education, number D, maternal and child. وقف الفيديو هنا واختار الخيار بشوف صحيح. The correct option is option number A, public. ليه اخترنا الخيار رقم A؟ نشوف rational. Vital statistics and control of communicable disease serve many functions such as identify, prevent, and control infectious disease that pose a threat to public health, including emerging and re-emerging infectious disease, vaccine preventable agent, and bacterial toxin and pandemics. So the correct option is option number A, public. Question number 266. A 6-month-old infant mother decided to wean her child. Which of the following is the best principle of the weaning process? The options are number A, start the weaning process by 8 months of life. Number B, gradually replace one breast session at a time. Number C, discontinue the nighttime feeding first. Number D, allow the child to take a bottle of milk or juice to bed. وقف الفيديو هنا اختار الخيار اللي بتشوفه صحيح. The correct option is option number B, gradually replace one breast session at a time. اللي اخترنا الخيار رقم B نشوف rational. Weaning from breastfeeding is the process of switching a baby's diet from breast milk to other food and drinks. When to wean is a personal decision and will be different from everyone. Each child may be ready to wean or stop breastfeeding at different ages. To make the process easier, wean over several weeks or more by replacing one breast milk feeding at a time and gradually replace more breast milk feeding over time. So the correct option is option number B, gradually replace one breast session at a time. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment or like or subscribe.